And this has sort of started to lead to some pushback, not so much, a little bit in Australia, but internationally as well. The idea of the density of outlets mattering is increasingly becoming a part of policy in different places. So California, for example, has restrictions on the number of types of outlets based on a per capita level. So each county can only have, say, one outlet of a certain type for every 2,000 residents. In the UK, there's this shift towards alcohol disorder zones, which council can declare and say, well, we have too many licensed premises in this area. We're going to make them pay some of the cost of policing and of tidying up the neighbourhood. So there's some idea now that this idea of having a dense number of outlets in a small area is problematic, is sort of reaching into policy. And local governments across Australia have been worrying about this for a number of years now. I'm just going to quickly run through some of the overall trends in Victoria for the last sort of 8 or 9 years in harms from alcohol. This is the general population, not just young people. And we're looking here at 6 indicators. The highest one is the number of hospital admissions for alcohol-specific diagnoses. So this is for not for sort of an assault or a fall. This is for alcoholic liver cirrhosis, alcohol dependence, alcohol intoxication, something that's distinctly alcohol-driven. And you can see that it's increased from around 35 per 10,000 population to just over 50, so an increase of around 50%. Episodes of treatment, the red line, has increased around the same proportion over time, quite a steady growth in number of people seeking treatment for alcohol problems. The green line, which is ambulance presentations in metropolitan Melbourne, not all of Victoria, where alcohol was flagged by the paramedic as a potential cause of the admission, be it for a fall or an assault. They've sort of ticked a box saying alcohol contributes to this problem, have more than doubled, 250% increase in alcohol-specific ambulance attendances in Victoria in the last decade or so. And similar, although less severe, growth in police-recorded measures of alcohol-specific domestic violence, in nighttime assaults in Victoria, and in people presenting to the emergency department just because they're so intoxicated they need some treatment. So again, not for assaults or road traffic accidents, but for being drunk, basically, alcohol intoxication. That's doubled in the last decade or so. So we've seen increases in harm over the same time period as we've seen great increases in availability. What we haven't really seen is increases in risky consumption, at least based on the survey data that we have. This is 3 different surveys trying to measure the proportion of Victorians who drink at risky levels. And you can see they ask the questions in slightly different ways, they have slightly different overall estimates, but the basic pattern in them is that there hasn't been a great deal of change since the early 2000s, that the proportion of people who are saying, I drink more than 5 drinks is basically stable. In terms of youth-specific trends, I haven't put any graphs in, but we've quickly looked at the data. The rates of harm for young people have been increasing more quickly than the general population rates. So we've seen, for example, a 200% increase in emergency presentations for intoxication in the last 10 years. But risky consumption rates, again, from surveys are fairly stable or even declining. Although there is some indication when we look at very high levels of consumption, people reporting drinking 20 drinks or more, that little tail end of the distribution might be increasing. So the number of people drinking 5 or 6 drinks or more is stable, but the shift of that towards the very high end is just a little tick that maybe that's going up a tiny bit. So this is from one survey showing the proportion of 16 to 24-year-olds who report drinking 20 or more drinks in at least one drinking session in the last year. You can see here, for both males and females in this survey, that has increased quite dramatically over time. The problem is, I have problems with any of the consumption data we've presented here. It's very hard to measure alcohol consumption. At an overall level, we don't have any estimate of how much alcohol is sold in Victoria. We have no data on sales, which let us get a sort of sense of the overall consumption levels. We do have that nationally, and they show sort of gradual increases in population consumption. Instead, for Victoria, we rely on survey response rates. And if you imagine someone ringing you up and asking you to talk about your drinking for the last 12 months, it's fraught with difficulty. There's a range of standard questions, but there's issues of recall. We're only getting response rates of around 50% of the population when we run these surveys. So to be confident in these estimates is a bit problematic. There's good evidence, I guess, that in a single survey, the questions that we ask will sort people into sort of heavy drinkers and light drinkers quite well. But I'm increasingly concerned about using surveys to monitor trends over time. Just for an example, this is 2 different surveys measuring the same thing, short-term risky drinking amongst young males and young females. In the dotted lines, which is a youth survey, we see sort of gradual increases in risky drinking. In the National Drug Strategy Survey for Victoria, we see decreases in risky drinking. So what you make of the trends in consumption from surveys, I don't know. So instead, we're more or less basically focusing on harm from alcohol, which we have a little bit more faith in the measurement of. So the statewide trends in harms are suggestive here that we've seen some increases at the same time as we've seen increases in availability. But to be confident there's some causal link here, I mean, there could be some other factor. There could be broad cultural change driving both these things. To get a better sense of causality, we try and do some more rigorous analyses. And what we do is look at all the postcodes in Melbourne that have remained fairly stable over the last decade or so. There's about 190 postcodes. And compare how they've changed. So some of them have seen declines in availability, some have seen increases in availability of different types, and see how that relates to the postcode level rates of harm. So you get a better way of measuring whether there's some direct impact here from changes in numbers of outlets. And I'm focusing on those three types of licences I presented before, the on-premise, which are mostly restaurants but also include bars and some clubs, package, which are your bottle shops, and pub licences, general licences. The first study looks at police data on reported assaults, just general assaults. Again, as I said, we're using fixed effects models, which is very boring, but quite appropriate. And we're basing the data here on where the assault took place. So this is the location of the offence rather than where the victim lived. And the results suggest that over time, all three licence types are linked to rates of assault. So all bottle shops, on-premise and pub licences all have some effect on rates of assault at a postcode level. By far the largest effect was for pubs, which may not be that surprising. And to try and get a sense of how this played out in different types of neighbourhoods, I mean, a pub in Northcote is going to be different to a pub in Broadmeadows in its effect on problems. So we looked at sort of 5 categories of postcodes and compared effects across those. So from the entertainment districts, the sort of inner urban areas, poor suburban areas, rich suburban areas, and kind of the fringe suburbs of Melbourne, to see if outlets had different links to violence in those different types of neighbourhoods. And pub licences were linked to violence at almost all types of postcodes. So you add pubs, you see more problems, particularly large effect sizes in the central areas around entertainment districts. Bottle shops were linked to violence in the suburbs, but not in the inner city or inner urban area. And on-premise, which are your restaurants or bars, were linked to violence in both the inner urban, kind of the Fitzroy, Northcote sort of areas, and in the more suburban areas of Melbourne. So what we can conclude from this first study is that the changing the number of outlets in Melbourne in the last decade has been linked to the increase in assaults that we've seen in police data. The relationship is particularly strong in the central suburbs, which might suggest that adding new premises to areas where there are already many premises is particularly problematic. Maybe you've reached some sort of saturation and you add another pub to the CBD, you see more harm than if you add it to a less dense area. We then conducted a similar analysis looking at domestic violence, again relying on police data. There's been very little work in this area. 2 studies that we could find when we did this work originally. One found no effect, and one found a small positive effect. So we thought we'll try and both of those were just looking at one point in time rather than change over time, which I think is more important. We control here for socioeconomic factors, which have been shown in a number of studies to be linked to domestic violence, and poorer neighbourhoods tend to have higher rates. And again, we find here some significant effects. We find pub licences and bottle shop licences both positively related to domestic violence. When you compare effect sizes, I mean, the pub effect is quite small. The effect for bottle shops is quite substantial. For example, in an average kind of pretend postcode, a 10% increase in the rate of packaged liquor outlets would lead to around a 3.5% increase in domestic violence rates reported to the police. So that's quite a substantial effect when we're looking at domestic violence. And as I say here, this is only looking at reported domestic violence. It's a very small proportion of actual domestic violence that takes place in the community. Around a third actually gets reported to the police, according to survey data. So again, here we have some reasonable evidence that availability of alcohol in terms of number of premises is linked to domestic violence at the postcode level, even when controlling for socioeconomic factors, and that bottle shops really are the key driver of this effect. Our third study looked, there's some issues with using police data, which our first 2 studies relied on. It depends a little bit in how police decide to devote their resources on what people want to report to the police. So there are changes that are outside of the kind of realm of what we studied. So we shifted to look at hospital admissions here, which may capture a more reliable trend. Although, I mean, it's worth comparing at least. And so, sorry, we're looking at two types of admission, and this is not just coming to emergency room, this is being admitted to hospital, so it's quite severe, for violence, for an assault victimisation, or for a chronic disease specifically linked to alcohol. So again, this is alcoholic liver cirrhosis, alcoholic pancreatitis, alcohol dependence, and a few other small ones. So this is looking at the sort of chronic disease end and the acute harm end for violence. We had a longer time period for this because the hospital data we have goes back further. And we had all hospital admissions for Victoria. But again, we're just focusing on Melbourne here, on the urban area for these studies. And so the difference with this study is that the hospital data has just the postcode of the patient's residence. So we're not, somebody might live in Fitzroy and be assaulted in the CBD and admitted to hospital. We're taking them as from Fitzroy. So it's not where the assault happens, it's sort of, does living in a neighbourhood with this number of pubs affect your risk of being assaulted anywhere, or your risk of chronic disease? So it's a bit of a shift in approach. And again, the same story basically. Pubs and bottle shops were both linked to assault-related hospital admissions. Quite small effect sizes for both of these things, but again, we're focusing here on the most severe assaults. In survey data, around 15% of victims of assault report seeking any medical help, from seeing a GP to an ambulance or an emergency department. Only a very small proportion of those would actually be admitted to hospital. So maybe we're talking about the most severe, sort of 5% of assault victims here. In terms of chronic disease, packaged liquor licences, so bottle shops, and on-premise licences were the ones that had an effect here on rates of chronic disease. Again, the largest effect was for bottle shops, so packaged liquor. In an average postcode, each new bottle shop is associated with around one extra admission for an alcohol-specific chronic disease. And this is excluding a number of chronic diseases that we know have links to alcohol, a range of cancers, heart disease and so forth, which are not purely alcohol-specific, which were the ones we focused on.